Hi, I'm Elin from Mayo Clinic, and I'm here at EHA 2025 in Milan. I'm very excited to share with you results that my collaborators are presenting at this Congress on how we are using AI and machine learning to analyze the clinical data in patients who are receiving CAR T-cell therapies to be able to predict the onset of cytokine release syndrome days before patients may experience that first symptom. So fever oftentimes is the most common first symptom that patients may feel and can be clinically detected. And currently, management starts when patients have their first fever, with tocilizumab as the frontline treatment for cytokine release syndrome. And this is the type of side effect that really limits the centers that are able to prescribe and manage CAR T in that first month after infusion. So we wanted to use AI tools to see if we can be more able to predict that onset to help these CAR T centers to do more individualized, patient-directed, risk-adapted management. This may help the centers be able to use their clinics, hospital beds, and resources much more effectively and efficiently, and help the patient potentially stay outpatient in more setting and not need to come into the hospital until they need that escalated management. And having a tool like this may also enable us to identify even earlier preventative strategies to study so that there's a side effect like cytokine release syndrome could be reduced further in the future. So what we're able to find out is even just with current clinically available data, so things like vital signs that you may normally be taken in the clinic visits and labs that are standard being done in patients post-infusion, AI can predict when the patient may experience that first fever, even 1 day, 2 days, or up to 3 days before they have the fever. And this is during times when patient may feel perfectly normal and not necessarily have any of these symptoms. So we're hoping that, this is something that can be implemented in that real world practice as we see that, hospital access can be a limitation to the number of patients that we can treat with CAR T, as well as with bispecific antibodies, where they may experience some of these same side effects.